Lack of insurance coverage prevents individuals and families from accessing the healthcare they need and results in negative health outcomes. Affordability and immigration status are the top barriers to accessing health insurance and care.
We get over 1,000 phone calls a week with people looking to schedule an appointment with us who are either uninsured or underinsured. We're one of a few free clinics in the state, but the volume and the needs are very high right now.
Even if I see you in a free clinic, I can't do a lung cancer screening or a mammogram that day. We can order all the tests in the world, but if patients do not have a way to get the test done, then it won't work. People who are uninsured postpone routine care, screenings, and prevention, which can then lead to bigger health problems down the road.
They get sicker and sicker until they end up in the ER or at urgent care and are faced with these devastating medical bills. So it becomes a vicious cycle of not having the access and then continuing to get sick because there's no plan for maintenance in place for them.
Soy una migrante de Ecuador y vivo junto con mis 2 hijas. Cuando pienso en el acceso de seguro médico es algo que me llena de mucha tristeza, porque lamentablemente personas como mis hijas y yo no podemos recibir el cuidado que necesitamos, ya que nuestro estatus migratorio no nos deja tener acceso a cobertura médica.
In New Jersey, we currently have over 660,000 people who lack health insurance. So 1 in 10 working age adults, 1 in 7 people living in poverty, and over 1 in 3 of our non-citizens living in the state currently do not have coverage.
Healthcare is honestly just very unaffordable. I was in a car accident myself, and I'm not able to afford the general basic examinations and treatment for that. I can't even get physical therapy or just basic treatments. I can't see a pain management doctor or mental health services that I do need after this.
I help children who are uninsured obtain health insurance. Sometimes it takes 6 to 8 months for them to get coverage. Many families may not even be aware of underlying health issues due to the lack of insurance. If everyone had access to health insurance, many people would be motivated to prioritize regular checkups and maintain their health.
New Jersey has a consistent history of implementing policies that continue to expand access to health care, but there is a growing uninsured rate. There are also impending threats to our health system. We need policymakers to expand our public programs and systems to allow those with no other options to access the health care they need, whenever they need it, and at a price they can afford.
Expanding access to insurance would be the primary solution. We could do this in a number of ways, such as expanding who is eligible for Medicaid, increasing subsidies for marketplace plans, or incentivizing employers to provide affordable coverage for their employees.
La solución sería ampliar la cobertura de atención médica para incluir a todos los habitantes de New Jersey, incluyendo a los no ciudadanos.
Families and sponsors of children need to know that their information when enrolling in healthcare will not be given to federal immigration authorities, that their information is safe and secure, and that they can enroll in health coverage and get the care that they need without fear of legal trouble.
We also need to make sure the application process is accessible, especially for families with language barriers. English might not be their first language, and the multiple steps and barriers that they come across make them not even want to try to apply.
It's important for the healthcare field to have diverse providers because it's essential that patients feel seen and represented when they're receiving care. They're more likely to divulge the full story when they're not having to think about, how am I going to say this in English, or is this going to get translated properly?
And also reducing the cost of everything for out-of-pocket payers, like myself. These are things that I need to take care of, so just reducing the cost would be help, honestly.
At the heart of the issue is coverage, pure and simple. With more coverage, we can reach more people, intervene earlier in health issues, and prevent health issues from arising.